Okay, well, I see a pause in our folks joining, so I think it's a good time to go ahead and get started. So welcome, everybody, to our monthly Lunch and Learn series. I see several familiar names on our participant list, so good to have many of you back, and welcome to those who are joining us for the first time. This has been an ongoing monthly education series, really for the community. So some of this is very patient-driven. Today's presentation is really focused on the folks who take care of the patients in so many ways, our caregivers. We are going to pause in December, but start up again in the new year. So look for all of those sessions starting in 2025. Just to kick off, I'm going to introduce myself before I turn it over to my colleague, Dinah Foster. I'm Alex Huffman. I'm the Director of Supportive Care and Integrative Oncology at the Cancer Center. Today, we are talking with Dinah, one of our clinical therapists here, about oncology caregiving. This is going to be recorded, so as a registrant, you will receive the PowerPoint slides and the recording probably sometime next week. So that way you'll be able to share it. You'll be able to revisit some of the important topics that you might want to review. So you see that everybody is muted as we're in this presenter format. We will have time at the end for questions and answers. So please put those in the chat. You can put them in the chat at any point, and we will get to those at the conclusion of Dinah's presentation. And just to note too that while we want this to be as helpful as possible and as generally appealing as possible, we will not be able to answer specific questions on your personal scenarios. So just keep that in mind that we want to want this to be a really helpful time for you, and we will try to get as many answers to you as you can. And if those are more personal questions, we'll make sure we get you connected to the right folks here at the Cancer Center. So I'm thrilled today to welcome Dinah. Dinah and I have worked together since I've been here, which has been almost 10 years now. So it's a really great privilege to be able to host this alongside her. Dinah is currently a clinical therapist at UT Southwestern Simmons Comprehensive Cancer Center. Her focus is working with individual oncology caregivers and supporting them as they navigate the cancer journey with their loved one. Dinah also co-facilitates our monthly oncology caregiver support group. She's been a social worker for 24 years, believe it or not, previously working in psychiatric and medical social work roles. Dinah's worked here at UT Southwestern for 21 years. Dinah enjoys live music and spending time with friends, family, and her rescue dogs when she's not doing what she's joining us to do today. So thank you again, Dinah, and we will turn it over to you.
Okay. Thank you, Alex, and thank you everybody for joining us. Just be aware that I cannot see you, but I have the knowledge that you are there and listening and engaged, and I will try to make this the presentation that you all are looking for and want and hope that it's applicable and helpful to you. So I think starting out, just a quick overview of my presentation today. We're going to talk about what is a caregiver, what is an oncology caregiver, what are some things that go along with that, and then those ideas with what does that mean when we're coming up on the holidays really quickly here, Thanksgiving holidays and then December, multiple holidays depending on your regions. We're also going to cover some how to cope with being a caregiver and how to cope with being a caregiver during the holidays, how to take care of yourself, how to take care of your loved one, and how to get support, whether that's at UT Southwestern or other resources as well. So like Alex mentioned, please feel free to enter any questions into the chat, and we are going to do a question and answer after the presentation is completed. And some of these slides are really busy. And so some of them have a lot to read or a lot to look at. And I know sometimes it's hard to listen and read at the same time, but we will be able to address some of your questions and hopefully I'm going to leave time to do that. So I may burn through these slides pretty quickly, but just know that we will definitely have you discuss afterward. Again, I want to just give a special shout out to my teammate and coworker, Valerie, who did help contribute to this presentation. She is my co-facilitator for our oncology caregiver support group, and so some of you may know her. Okay, what is a caregiver? So a caregiver is Ethan, who has a significant personal relationship with and provides a broad range of services or assistance for a person with a chronic or disabling condition. So that's pretty broad. A caregiver can mean a lot of different things. And more specifically, what is an oncology caregiver? So this was news to me that there were 2.8 million cancer caregivers in the United States. And sometimes I use the word oncology, sometimes I use the word cancer. Those are the kind of the same thing. So hopefully that's not too confusing. But that's a lot of people providing care to a loved one with a cancer diagnosis or an oncology diagnosis. Um, One thing that we did find when I was doing some research on this is that cancer caregivers devote 32.9 hours a week doing caregiving. That's almost a full-time job. So that is a really huge task, especially if you're working full-time, you're a parent, you're an employee, there's lots of different roles, and that it takes up a lot of time being an oncology caregiver. One thing that is also unique about being an oncology caregiver versus just a general caregiver is that cancer caregivers reported, a high burden of stressful situations as they're caregiving, um, a little bit different than a general caregiver. A lot more help assisting with daily activities, bathing, feeding, things like that. And we'll get into that a little bit more in detail in the next couple of slides. So it's a complex job, I guess is what that's saying there. So who are oncology caregivers? So the research tells us that um, many are women, many are caring for a relative, many live with that person. It's a very stressful job. Most people are working while they're caregiving. Um, And specifically oncology caregivers, a lot are doing medical tasks. So I don't know how many caregivers are actually working in the healthcare field as their profession, but there are a lot of medical tasks that go on when you're an oncology caregiver. And many people reported needing help to manage the emotional and physical stress of caregiving. So oncology caregivers, again, some specifics about what makes them different or what makes you different than general caregivers is you definitely influence each other's physical and mental health, the patient, so the person with the diagnosis, and the caregiver. Um, and, the caregiver's well-being is important as well as the patient's well-being, and they affect each other. The caregivers are absolutely vital to the cancer patient's well-being. Um, And that means physical well-being, mental well-being, um, emotional well-being. And sometimes caregivers and patients have different needs or different challenges as they're going through this cancer experience or cancer journey. They may identify things that are different, different stressors or different challenges. And so I think it's really important to recognize that, there may be some overlapping, but there may be some that are unique to your role as a caregiver. And sometimes caregivers, that's a role that maybe they didn't choose or they weren't expecting, or something that, was really new and maybe stressful time to take on that role. Some people said that they did that out of love. Some people said they felt a sense of responsibility or duty. And some people said that they did feel some guilt in that. So there's a lot of different feelings that come along with being a caregiver. So, what do caregivers do? And again, this is sort of general caregiving, but also applies to oncology caregivers as well. So, they provide physical support. So, helping somebody get from point A to point B, um, going to the bathroom, getting dressed, maybe feeding someone, managing their medications. They also provide practical and instrumental support, things like grocery shopping, preparing the meals, going to the pharmacy, um, also just household management, laundry, cleaning, yard work, um, also taking someone, driving someone to an appointment, coordinating appointments with the medical team. Sometimes that includes communicating with the medical team. And also just emotional support. That's also really important to listening, being empathetic, validating, and encouraging, um, just reassurance. So caregivers have a lot of roles and a lot of responsibilities. So some tasks that are unique to oncology caregivers, which you probably, if you're an oncology caregiver, you probably know these things, but these are some things that are really unique to oncology specifically. So knowing the risks and benefits of chemotherapy or radiation, monitoring side effects from the disease itself, medications or treatment. That could be things like energy level or fatigue, nausea, vomiting, lots of things that come along with side effects from treatments. Also monitoring weight and nutrition is also really important in an oncology setting. So making sure someone's eating, hydrating, monitoring someone's weight, um, assessing medical symptoms. So again, I don't know how many oncology caregivers are work in healthcare or they're a nurse or they're a medical assistant or something like that, but there are a lot of medical tasks that are new to oncology caregivers. Monitoring pain levels, fever, swelling, things like that are really important. And again, managing side effects and keeping track of those, maybe keeping a log. Again, administering medications or managing medications. A lot of times people will have the box, the med minder with the each day or each time of day. Sometimes that can get very complicated. Also hygiene, especially when someone is on chemotherapy or is immunocompromised, hand washing, sometimes using gloves or a mask. Especially during flu and COVID and different winter diseases and syndromes going around. Just safety and disposal of fluids. Also things like managing PICC lines or ports, catheters, tube feedings, wounds. I mean, these are things that nurses do, but sometimes when we're at home, um, there's not always a nurse there to do these things. And so that becomes the role of either the patient or the caregiver. And these are definitely unique to oncology. Also, the coordination of care, that's kind of a healthcare term that we like to use a lot, but really what that means is, managing communication with the medical team, managing appointments, keeping a calendar, making sure that people can get taken to appointments, picked up from appointments. And sometimes those appointments, multiple ones during the day and take up a lot of time. So that takes a lot of effort. Um, Also, just monitoring the home for safety, making sure, that there are no fall risks, if you have stairs or you have rugs or you have doorways that are too tight, um, making sure the bathroom is fitted to prevent falls. So, well, there's a lot of things that are unique to um, oncology caregivers, and just there's a lot of responsibility there. So, as evidenced by the long list that I just gave, and many oncology caregiver reporters feeling underprepared and overwhelmed. So just want to normalize that if anybody is feeling that way, that is the thing that was greatly reported when I was doing some research for this, and that we know just anecdotally that it can feel really overwhelming. So sometimes when we're a caregiver, we're balancing multiple roles. And I know I covered this just a bit before, but that we may have a role of caregiver, um, wife, husband, spouse, partner, parent, employee, patient, friend, daughter, son, sibling. So a lot of roles, and just balancing those roles is a really sometimes can feel like a really difficult task. So, kind of getting into feelings, how might you feel if you're a caregiver? And I put these emojis on here. I just thought it was kind of funny, because we use these a lot in texting, and so this may feel familiar, but so you might feel overwhelmed, you might feel exhausted, you might feel isolated, and feel angry, lonely, scared. Um, there are a lot of feelings that come with that. However, some feelings you also might feel as a caregiver is just feeling an increased sense of compassion or a sense of empathy, or maybe being a caregiver really causes you to feel a sense of pride in the job that you've taken on, or a sense of personal growth, maybe even deeper relationships or increased meaning and purpose. So, lots of different feelings as a caregiver. So we're shifting into the holidays a bit. I know it took me a minute to get to the holiday portion of this, but I was getting there. Um, but just feelings, so kind of uh, putting together feelings you might feel as a caregiver and feelings you might feel around the holidays. They overlap a lot. So feeling stressed, feeling grief, loneliness, financial strain, guilt, disappointment, overwhelmed. Um, some of these same feelings come up if you're a caregiver, um, and then a caregiver at the holidays. And so a lot of similar feelings. Um, Sometimes, we also feel joy, love, excitement, gratitude, hopeful. So, a lot of these same feelings we might have as a caregiver, we might also experience during the holidays, and whatever holiday you're celebrating, whether it's Thanksgiving or the variety of holidays that come in the month of December. So, this is a metaphor we use quite a bit. It's just sometimes this cancer journey and sometimes the holidays really feel like an emotional roller coaster. So being able to expect the unexpected, to remain flexible, and also I feel like the kind of the hopeful message in this is that we are resilient. And what that means is, successfully adapting to change, especially when it's challenging, and that we do have the capacity to do that. So, we're going to shift into grief just a little bit because sometimes being a caregiver and being an oncology caregiver, and sometimes just the holidays, that can definitely highlight feelings of grief. So, this is probably the traditional model that you all have seen um, around about the stages of grief: denial, anger, bargaining, depression, and acceptance. And sometimes we see it as a linear model like this. Well, guess what? Doesn't really work like that. So here's the slide that I like better. Um, the grieving process, maybe what you expected, sort of in a linear fashion, and then what you experienced. And it kind of goes into this, what we like to call kind of spaghetti mode, grief spaghetti, that you can go back and forth throughout these stages, forward, backward, around, upside down, that sometimes it just doesn't go in a familiar or expected path, and that's okay. That is um, absolutely appropriate. So. There's also a concept within grief called anticipatory grief. And when we talked about this in our oncology caregiver support group, a lot of people said that they didn't really know about this term. They weren't really familiar with this, and they thought like, what are these feelings that I'm feeling being a caregiver? Um, and that it is a very real thing. So it's a grief that occurs before a loss. It can be sadness, it can be sorrow, um, it can be mourning, but it's very, very common among caregivers, oncology caregivers, and just caregivers in general. Um, and so here are some symptoms of anticipatory grief: numbness, guilt, sadness, anger, fear of the future. That this is a very normal thing. I think sometimes we associate grief with someone dying or passing away, and that we can have grief with a lot of other things. It doesn't necessarily have to be associated with a death, but there are lots of ways to experience loss. And so sometimes that's what's happening when a person is diagnosed with cancer or going through their cancer journey. We do have some losses. Um, and that could be anything from loss of, you know, your the way that you functioned on a pre-cancer diagnosis day. Um, the loss of, maybe a work role or a parenting role, or um, it could just be any number of things that just when things change, that sometimes loss can be around anything, and not just the idea that it's around the death of a person. So also some other myths of grief. So we kind of touched on this earlier, is that we grieve in linear stages, which is not true. It just doesn't work that way. Sometimes we think that there is a right and wrong way to grieve, and there's just not. It's very individualized. Um, and that another myth is that grief follows a timeline. That it should be, there should be a finite period. It should be over at some point, and it just doesn't work that way. And I think their tendency is to think or want to move away from grief. And sometimes we have to, instead of going around it or going away from it, we kind of just have to go through it. Um, so those are some myths of grief that, can help us think about grief in different ways, and normalize it and validate it. So also just grief during the holidays. So whatever holiday you are celebrating, whether it's Thanksgiving or any of the December holidays that are coming up, grief doesn't take a holiday. So if you're grieving, that may impact your holiday, and recognizing that the holidays might be different this year. Um, they just might look different. They might feel different. You might do some different activities. So if you're grieving during the holidays, these are some ideas that we have that you may want to do in remembrance, or just by taking a quiet moment, or a solemn moment to, light a candle, um, plant a plant or a flower, maybe make a box of some remembered items, or just write down memories. Um, and again, this doesn't always have to be around death, that can just be around just general grieving. So some rituals and traditions around the holidays, these are probably some familiar ones to you. But the holidays can be a really busy time, and they also can be full of traditions, things that we do every year consistently. And just with the realization that sometimes with a cancer diagnosis or a cancer treatment, you know, it can impact how we're doing things and the things that we would normally do. So things like holiday cards, decorating, shopping, cooking, um, going to a religious service, having out-of-town guests. So these, you may have different rituals or traditions that you do in your family, um, and they may look different during this time. And so the next slide is just kind of thinking about, how do we modify rituals and traditions during the holidays when we are a caregiver? So thinking about, do we want to send, 50 cards to friends and family this year? Um, do we really want to put up those outside lights? Do we want to put up a tree or a menorah? Um, do we want to go to all these parties? Can we go to all these parties? How much time do we want to spend cooking a giant meal and with all the sides? Um, do we want to go to a religious service? Is that, something that's important to us? And guests, do we want to have guests? Do we have the capacity to have guests? These are things that provide, or that take a lot of effort and energy. And sometimes when we're a caregiver, or when we have been diagnosed with cancer, our energy resources are limited. And so it really is helpful to think about, okay, if I have limited energy resources, how do I want to use that? How do I want to use my energy? What are the most important things to me? And what are some things that we can be like, okay, I don't have to do that this year. That's not as important to me this year. So just kind of thinking about what that looks like for you and your family. So these are some coping that we can think about and discuss to when we're a caregiver during the holidays. So, eliminating unnecessary stress. So, the holidays can be a really stressful time. Being a caregiver it can be really stressful. So, not overextending ourselves, not isolating ourselves. And sometimes we do tend to want to keep busy if we're feeling stressed, and just recognizing that that may be a temporary distraction, but and if especially if we're having grief, again, that might be a distraction from that grief. But sometimes that may actually increase the stress if we're being over busy or over committed. And so sometimes we may just need to take a minute to think about how we're feeling or to talk about how we're feeling with somebody that is a supportive person. So, um, planning ahead for family gatherings. Again, I know sometimes this one is big if our loved one is immunocompromised or if we're wanting to be really vigilant about things like COVID or the flu or RSV, different things like this. And sometimes we have to um, make changes in the types of gatherings that we're having around the holidays. So thinking about what traditions you want to keep and what things can maybe change. Um, and just allowing for that change and to have it be okay that this year might look different than years past. So also just being with supportive and comforting people. So identifying which friends and relatives are comforting to you. Um, I don't know about you all, but sometimes we have friends or family who tend to kind of increase our stress and make us feel um, overwhelmed. And so just thinking about who do you want to be in your circle during this time and just being aware that, this is a stressful time if you're a caregiver and it's during the holidays. So maybe who can you talk with or who can you sit with, who can you share things with? Whether those things are when you're feeling good or when you're not feeling so great. So and also, a lot of times around the holidays, people have faith traditions that are really important to them. So, thinking about um, how you want to integrate your faith into this time, um, whether that's you want be, going to a religious service or having something at your home, doing a reading or lighting a candle, things like that. Just kind of think about, again, how you want to do that if that's important to you. So this is the big one. It's a big part of what we call self-care is, being tolerant, being aware of and being tolerant of your physical or psychological limits as a caregiver and also during the holidays. So feelings of stress and grief can make us feel fatigued. It can really make us feel like we're have low energy. And just to be respectful of what your mind and your body are telling you. Um, and sometimes that means lowering your expectations about what it means to have a great holiday. Um, and knowing that you just may not be at 100% and that's okay. So we know that the impact of a cancer diagnosis or a cancer journey on caregivers is emotional, physical, mental, social, financial. It affects many, many different aspects of our lives. And some of the needs that we identified in oncology caregiving that are unique to, again, the oncology experience are people who have a cancer diagnosis or navigating the healthcare system, psychological and emotional needs. And a lot of people really mentioned that they struggled to get disease information and treatment related information, that they just really needed more information in order to take on this caregiving role. Um, and that, if there are unmet needs, if there's not enough information or not enough support that it really impacts the life of the patient and the caregiver. So you may be a caregiver, and there's lots of different stages of being a caregiver. Some you may have been a caregiver in the past. You may be one currently, and you may have been one before the loss of someone. So maybe you're not a caregiver anymore because maybe your loved one is in remission, or maybe your loved one has passed away. And so there's lots of different types of caregivers, and those each come with unique needs depending on where you're at in your caregiver journey. So caregiving needs, again, I'm just re-emphasizing this, is that a lot of caregivers reported needing more information, and that they really had unmet needs as a caregiver in order to take the best care of their their loved one with a cancer diagnosis. So information was kind of the number one thing. A lot of caregivers mentioned that they really needed more emotional support. They needed help making these treatment decisions. They also wanted to know, when do I contact my medical team, and who can help me? So again, sort of more a lack of information is what a lot of caregivers reported during the oncology caregiving process. And also just the awareness that sometimes when we do have unmet needs, it puts patients and caregivers at a higher risk for experiencing anxiety and depression. And so we want to really be aware of that and be aware of the resources that are available to cope with that. So utilizing your your healthcare team is really a huge place to get support. Doctors, nurse practitioners, PAs, radiation therapists, nurse, rehab, dietitians, social workers, chaplains. There's a huge variety of disciplines and support in your oncology team. And so knowing who those people are for you, or who they are for your loved one, and when to contact them is really important. Knowing how to utilize the MyChart, or which phone numbers you're using to communicate with the team, that is a really important thing, and can really feel empowering when you do have that information. So other interventions to help meet caregiver needs, therapy, integrative therapies, counseling, education, and seeking out other care specialists, maybe outside of the cancer center, physical medicine, pain management, palliative care, so things like that. So again, we're sort of integrating the holidays into this caregiving experience, oncology caregiving experience, is trying to eliminate unnecessary stress. So sometimes it's really hard to eliminate all stress, but eliminating unnecessary stressors, planning ahead, being with supportive people, expressing your faith tradition if you have one, and just being aware of your limits and being able to set a healthy boundary and know where that is for you personally. So one thing we did just want to touch on as well is just caregiver burnout. And so this is a term that, again, we mentioned this in our oncology caregiving group. Some people weren't familiar with this term, but it's just simplified. It's just a feeling of feeling really overwhelmed when your caregiving demands exceed the resources that you have, and that can just feel really overwhelming. And so there are a lot of factors that contribute to that, but employment, financial stressors, living with the person you're caregiving with, if your sleep is off, a lot of times that's one of the first indicators that we're feeling overwhelmed, is that our sleep is less, or our sleep is inconsistent, or it's not quality sleep. So, just paying attention to these things, paying attention that we're not isolating ourselves. And sometimes just being a caregiver over a long period of time can really contribute to burnout. That we just want to be, again, sort of bring these things to our awareness, be watching out for them, and be thinking about, how can we intervene, and how can we help prevent these things, or how can we cope with these things if they happen. So again, some kind of a list here to reminders for ourselves for self-care when we are a caregiver, asking for help, getting support, knowing your limits, talking with other caregivers, taking breaks, acknowledging your feelings, um, eating a healthy diet, getting some movement, getting some sleep, and just making room for things that you enjoy. Um, we like to say in our group, integrating joy into your day. Find a space for that. So again, just some examples of healthy self-care, and that can be anything. This is just some ideas. Yours might be on this list, and maybe it's not. Just getting outside, reading a book, being with pets, journaling, meditation or quiet time, music, art, cooking, getting together with friends. And sometimes these healthy self-care things are part of our holiday traditions as well. Cooking, getting together, getting outside, and just thinking about, how can we take care of ourselves in our oncology caregiver journey, as well as, how can we do that during the holidays? So self-care during the holidays, again, just another slide kind of re-emphasizing these things. Sometimes you may have a friend or a family that wants you to do things a certain way or feels like um, they would like you to do things a certain way, and just thinking about what do you want to do and what do you have the capacity to do, and knowing that that's okay. Again, that the holidays can look different and might look different, and that's okay. And sometimes talking with people about what you want to do or what you have the capacity to do is really important, and sharing what you need from others. Because sometimes people will ask, well, what can I do? What can I help with? And to think about, what do I need and what do I need help with? Um, it's really important in the caregiver journey, and during the holidays. And putting those together, again, just sort of bringing that to our awareness. So setting realistic goals, allowing people to help, and permission to take breaks. If you need a break, if you need some alone time or some quiet time, to do that without guilt, to give yourself permission to do that because you deserve that, and it's absolutely okay to do that. And let me go ahead and validate that sometimes we just need that, and that's okay. So again, some healthy self-care during the holidays, setting boundaries, adjusting expectations, giving yourself permission to say no, having gratitude, and just being with supportive people and people you love, people you trust, people you can talk to or just be with. So sometimes we talk about a caregiver daily plan, and this is not my plan. This is one we found. Doing, delegating, planning, and nourishing. And I will say one thing I don't like about this slide is that it leaves nourishing to the end. That's not I think that nourishing maybe needs to be first. It definitely needs to be on your list so that it doesn't drop off the list. Because part of doing our self-care as a caregiver is to find that time to nourish ourselves and not leave that to the very end where it drops off the list of to-dos, because that's really easy to do if we leave it for last. So maybe I should have reordered these, but I feel like it's a good point to point that out. But this is not my list. I think nourishing should be higher. So making time for that. So how do caregivers get support? Knowing who's on your support team, family, friends, neighbors, religious community, organizations, hobby groups, coworkers, support groups. So there are lots of different ways to get support. And knowing who's on it is also really important. Um, some ways that we can help with caregiving at home. Sometimes technology can really help us with these things. Smartphone apps, smart watch alarms, setting alarms for things like medication reminders, or getting in a medical alert so that when we as a caregiver have to leave the house, maybe our loved one would wear this device and it makes us feel a little more secure about leaving the home. Also cameras, having a camera in your home where you as a caregiver, if you need to leave and you can check on your phone and look at that camera and know, okay, my loved one is okay at home. Getting pill organizers or pill boxes, and sometimes just bringing in other people to help, whether that's home healthcare staff, nurses, physical therapists, or whether that's a hired aide or caregiver. Um, Being able to say, okay, I need a little extra help, and having someone to come in and do some of the tasks to help us do those things sometimes can be really helpful. And also medical equipment itself can be really helpful, whether that's a toilet riser or some shower bars or a walker. Whatever that is, sometimes that can be really helpful for mobility as well as just helpful for, fall prevention and safety in general. And knowing your oncology team. So I know I touched on this just a bit earlier. Excuse me, doctors, nurses, rehab therapists, dietitians, social workers, chaplains. Just sometimes we don't always get a full list of like, who's on my team? What do I have for support? What support is at the Cancer Center? What support is at UT Southwestern? And so these people, these professionals are available to every single person who comes to our Cancer Center at UT Southwestern. Um, and just other support in terms of caregiver support groups, mindfulness class, art class, spiritual support group, disease. Some of the groups are disease specific, some are for specific age ranges, like our young adult group, and then are also other resources for if you have young children and for your family. We also have other supports at UT Southwestern, our Family Studies Center that offers individual couples and family counseling, also physical medicine and rehab. These are things like physical therapy, occupational therapy, speech therapy, so palliative care. Their focus is on symptom management, all the symptoms and side effects that go along with having a cancer diagnosis or cancer treatment, and then pain management as well. So these are supports in the community. Some are local and some are national. I just listed out some organizations here. I know I'm burning through these slides pretty quickly, but I want to make sure we allow for some time for question and answer. Also, some websites that are really helpful for caregivers, specifically oncology caregivers. Again, I'm burning through these pretty quickly, but these are just some ones that we found. Again, some are local, some are national. And then this one, we're coming to the end of our me talking my presentation here. So caregivers are vital to the health of the cancer patient, and caregivers' own self-care is also vital. And sometimes you use the metaphor of put on your own oxygen mask first. If you're on an airplane, they tell you put on your mask first and then put on a mask to your loved one. And there's just kind of a visual or a metaphor that we use for just taking care of ourselves is sometimes the best way that we can be the best caregiver to our loved one. And that self-care isn't selfish. Self-care is caregiving is selfless. And that just a couple of quotes about caregiving that I liked here. And that is it. So
Awesome. Thank
thank
you
you,
so
everyone.
much, Dinah. And you have lots of thanks in the chat as well. Lots of notes that, this is such an important topic, and especially around the holidays when we get pulled in so many directions. So thank you. And now is your time to throw any more questions in the chat. We have a few, but we'll definitely have time for a couple more. And I did want to just note again, I know Dinah mentioned that she was going through the resource slides pretty quickly. You guys will get a copy of the slides. You'll get this recording as well next week. So you'll have access to all of those good resources. So first question, Dinah, is can you talk a little bit about the difference between grief and mourning? And how would caregivers know when to ask for help? What are those signs that say, oh, maybe this is a state where I could use some extra help?
Oh gosh, okay, that's a big one. Well, I think that grief is something that can come either before a loss or during a loss, after a loss. And I think generally when we think about mourning is usually, I usually think of it as maybe after a loss. But grief can come with at kind of any stage, at any time, and not just after a loss. And so I think that there is some overlap there. And there are probably other professionals that could articulate that better than I could. But I think when your feelings of overwhelm or sadness or um, loss, loneliness, isolation, fear, those types of things, when they really start to impact your day and impact your daily functioning, I think that's when is a good indicator to know when to reach out, when to ask for help, or when to accept help. Um, that, really just paying attention to ourselves and doing a check-in with ourselves. Where am I at? Am I feeling out of balance? And just being kind of bringing it to our awareness is really the first step for that. Um, I don't know if that answered the question, but that's my on-the-fly answer.
Yeah, and I might throw in, kind of my general response to the difference between grief and loss. I think grief is the umbrella term, as you mentioned, for all the feelings, all of the emotions, and the behaviors that come with significant loss. And I associate mourning with the process of externally demonstrating our grief. And that's where some of those rituals that you went through and those exercises become so important. I think, especially as caregivers actively caregiving, we may keep back the mourning from our loved ones and the people in our support group. And that's so important that external expression is included and validated, and becomes a healthy healing part of caregiving. So that's kind of my general thought between where the two land.
I like that.
And thank you so much for identifying kind of the win, which is hard. And I think that's where a support group can come in really helpful, because you can start when you feel like you need to start. They're open ended, and so it adds some flexibility to when you ask for help and what that looks like.
Yes.
Let's see.
Like there's
Another,
no ending point, right? You could do it at any time.
yeah. Yeah, and same with grief, right? We will hold aspects of grief our entire life. It may look and feel differently, but we will have that as an extension of the love that we have for people. Here's one that is acknowledged as a touchy subject, but also really, I think, an important one as we go into the holidays. But how could people, caregivers especially, help or upfront manage all of the high emotions around the elections going into family gatherings? What suggestions might you have when, life is all around us tense right now, and you've got, significant stress from caregiving added into the holidays? How might we be able to best set up our holiday activities with our loved ones?
Man, that is a tough one. Wow, I guess I needed to be more prepared for these really, really insightful questions. I think, I'm not sure that I have a great answer for that, but I think um, just remembering that when we have a higher stress level as a caregiver or higher stress level in general around the holidays, to just be aware of that. Be aware of where we're at. Again, sort of paying attention to how we're feeling, what we're thinking about, and also just one thing that really resonated with me was that just having compassion for ourselves, being gentle with ourselves, and sharing that with others as well, being gentle with others, having compassionate for others, knowing that we politics in the election can be really divisive. It can serve to create boundaries between us. And I think what we want to do is, especially around the holidays, is be connected and be in community. And by focusing on things that do that, I think sometimes can be helpful. But just also just being gentle with ourselves, being gentle with others, and creating points of connection rather than putting up boundaries between each other,
Yeah.
each of us. Sorry.
Yeah, yeah, absolutely. I think you said that well, and focusing on what we can control. There's so much right now, in this kind of liminal space, that we can't. And so focusing on that at the holidays. reminding ourselves that the people we love are different from their ideologies, and that's the compassion that you mentioned. We can separate those things out, and then using our healthy boundaries, we can communicate to people coming to our holiday party that may not be the topic that is going to fly,
Uh-huh.
this holiday, and that we're going to put some regulations around that so that everybody can truly connect in meaningful ways. So I think we can communicate that in advance sometimes. That, what do they say, every good dinner party excludes politics and religion, right?
That's right.
So
That's right.
um, okay, so let's see, we've got a couple other great questions in here. Here's one, and this is also a little bit hard to, I think, approach. So we'll see what we can do. Oh my goodness, there's all kinds of things coming in. I lost it. Hold on, guys. This person shared that when she particularly gets overwhelmed, she might go to a response of avoiding, kind of shutting down, which can be really helpful reset. And it can also sometimes make it hard to reach out for help and kind of get yourself out of that hole sometimes. Could you talk a little bit about avoidance and its role, and again, maybe the how to navigate that?
Okay. Gosh, these are really good questions. I feel like should, I really needed to, I want to have these in advance. But no, these are great questions. So I think that sometimes it is our natural tendency to want to avoid or to want to isolate because we want a sense of safety, right? That's really important to us. And I think sometimes that wanting to create sort of a barrier between us and others makes us feel a little safer. But I think ultimately, what is ha loving and healing is to actually be with others and have connections with each other. And so again, I think it's just it helps to check in with yourself. Where am I at? Am I feeling like I really want to pull back? Am I feeling like I want to isolate? Am I feeling overwhelmed? Do I want to just shut down? And just also allowing yourself to have some quiet time, some alone time, to take a break. That I know sometimes it is really hard to do that as a caregiver. It's also really hard to do that during the holidays, but to give yourself permission to do that without guilt, to say that I do deserve this. This is for my mental and emotional and physical health and well-being, and have it be okay. And to also know that going through this alone can feel really scary. And so reaching out for help or letting others help you can also make us feel comforted and make us feel safe sometimes when we're feeling like isolating and withdrawing.
Yeah, yeah. And I think, so many times folks ask caregivers, what can we do for you? Our friends and family, how can we help? And we don't always have a great concrete answer. But in a situation like this, the answer might be, hey, I feel like I need to spend some time with myself for a little bit. Could you check on me in a couple of days, right? Kind of having that accountability check after a couple of days of isolating of, okay,
Yeah.
that was restorative, and now I've got someone checking in with me. So I think that's hugely helpful. And I also think we do everything we can to seek safety, and sometimes we go internally to do that. And once we can assure ourselves and affirm that we're safe, we can connect again with other folks. So let's see. We had one more question. Man, you guys have some great questions about
I do.
boundaries. Here's one. When do boundaries that we put up from, all of the external demands, we might put up boundaries with family and friends. When do they become barriers or walls? Which is kind of a similar question to avoiding and connecting.
Man, that's a good question. Gosh, again, I wish I had these before so I could prepare a really great articulate answer. But I think, again, I know I've said this a number of times, but checking in with ourselves and having an awareness of what am I thinking about? How am I feeling? How do I feel in my body? And just being aware of like, do I feel tense? Do I feel tired? Do I feel, um, where am I at? And recognizing that sometimes setting boundaries can be really helpful and to think about again, just sort of be aware, is this boundary isolating me or is this boundary protecting me? And to think about the difference in that. Um, and thinking about where do we feel safe? Where do we feel comforted? Um, to just bring awareness to that. Because I think it takes a purposeful awareness. I don't think we just think about that automatically. So
Yeah.
sort of just learning to check in with ourselves and thinking about what's in my brain, what am I thinking? Also, how am I feeling in my heart or in my spirit? And also physically, where's my body at? How does my body feel?
Yeah.
So, and sometimes that means taking a break and being alone, and sometimes that means, you know, connecting with others and but to be aware that that may take some extra time and effort to check in with yourself and do that. And then that's okay to think about what you need in that moment or that day or that week.
Yeah, flexible boundaries. Yeah.
Yeah.
And I think, one of the things I always keep in mind with boundaries is that we communicate them, and in walls, we don't usually communicate. So
Mhm.
that may be a good kind of read there. And I have a patient I work with who uses the analogy of windows and walls, and what's the difference between those two? So
I like
great
that.
questions.
I like that.
And just a reminder, yes, this will be sent out afterward, and we will include information about the monthly caregiver group. Dinah, is that group going to meet in December?
Yes, we are meeting in December, December 12th. Let me pull up my calendar here. December 12th. It is a Thursday evening. We meet at 5:30. It is a virtual meeting. We meet via Zoom. Um, and yes, we would love to have you.
Awesome. Okay, here's another great question. It might be our last in 2 minutes, Dinah.
I
How
know
do
I
you
took a long, long time with those slides. Sorry, I should have allowed for more time for questions.
No, it's
But
great. It's great. Here's the question is, how do you honestly, genuinely answer, how are you doing?
mm, that is a big one. You know what? I think my personal feeling, this is probably individual to each person, but my personal feeling is that there is a way to be honest and also gentle. And
Mhm.
so I think sometimes it says, this is a really difficult time for me, but I'm really glad that we're together. Or this time has been really stressful and I am feeling a little overwhelmed. I might need a little extra space this time, but thanks for asking. You know, to uh, again, this is a pretty individual thing, but I think it is possible to be honest and gentle at the same time and really let people know how you are doing, whether you're feeling positively or negatively. Um,
Mhm.
and whether you feel comfortable or uncomfortable about sharing those types of things, I think um, you just have to think about what works for you and what works for the person that you're communicating that to. Maybe talking with a friend or a family member might be a different response than, say, a coworker or just someone in the store or something.
Yeah.
So,
Yeah. And I know many support units identify one person to be the deliverer
uh-huh,
of information, and that can be really helpful.
uh-huh.
Dinah's really having a hard time, and she's gotten set up with some great resources. So, when somebody else can kind of sometimes field all those questions, that's great. All right. We had wonderful questions, guys. Thank you so much for your time today. I apologize if we didn't get to everything, but Dinah and I are both here resource wise if we can answer any questions or if you are looking for more resources. So look for your emails next week with this recording, the slides, and we'll make sure the info about the caregiver group is in there. Wonderful. Thank you so much, Dinah. Thank you, everyone who joined us, and I hope you have a very nice weekend.
Thank you, everyone.